unusual disease. Is any specific research being done as to why it affects our senior citizens more than others?
So I don't, because when you talk about anything that requires a robust immune system, as you get older, your immune system is not as potent as it is when you have ordinary experience with over decades and decades. The people who are very vulnerable are the elderly and those with underlying conditions. The same thing holds true for the immune system that screens for it is less robust. So it really is something that is kind of well known over a lot of studies.
Okay. OAN, please. OAN.
Mr. President, the Chinese officials are expressing some tones of discontent with how, where the source of this virus has come from, and they're spinning some odd narratives. What are your response to the Chinese officials who are doing that? And have they signaled any kind of resistance to upcoming trade talks in response to how we're handling this
No, we
virus?
have our deal with China. They're going to be buying $250 billion worth of goods and $50 billion from our phase 2 will start negotiating. I did read one article, but I don't think that article was representative, certainly not in my comment.
Thank you, Mr. President. Yamiche Alcindor from PBS
Yes.
NewsHour. My first question is, you said that you don't take responsibility, but you did disband. Responsibility do you take to that?
Well, I just think it's a nasty question because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know
We're
about
spending,
the,
no,
about
I
the
don't know.
reorganization that happened at the National
It's the
Security
administration. Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
But this was a,
okay.
this was an
Please go ahead. We're doing a great job. Let me tell you, these professionals behind me and these great, incredible doctors, and you want to say these are the best in the world. We're doing a great job. We have 40 people right now, 40. Compare that with other countries that have many, many times that amount. And one of the reasons we have 40 and others have, and again, that number's going up, just so you understand. And a number of cases, which are very small, relatively speaking, it's going up. But we've done a great job because we acted quickly, we acted early. And there's nothing we could have done that was better than closing our borders to highly infected areas. Please go ahead.
Thank you, Mr. President. Vanessa Yaklish for NTN24 for all Latin American countries,
Yes, sure.
and also for Spain, La Razón and Antena 3. I would like to ask you two very brief questions. One, for how long we're going to have the emergency, the national emergency?
I hope we need tremendous power, actually, and the Stafford Act and various other things that we're involved with and have studied and memorized. And I hope we won't need it very long, but whatever it takes.
So for now, we still don't know for how long. And something very important I wanted to ask you is, like, how do you really think it's essential coordinating with other countries and learning from their lessons that they already suffered the same situation?
Yeah,
So much,
we're in touch with Italy, and you know, it's a country that we love. We have tremendous millions and millions of people, origins from Italy, and we're working with them. They're in a very, they're in probably, relatively speaking, many of the countries that you know about, that you're writing about, and they're calling us asking for advice. They're asking for the advice of the people behind me. What they did, they...
Thank you, sir. States such as Washington State, New York, and other hotspots within this country. And a follow-up on Brazil. You're asking people who come back from Europe, Americans who are coming back from Europe, who now has coronavirus from Brazil, but you were exposed.
We know the gentleman that we're talking about, have no idea who he is. And that night I was tested negative, so they have very tough. It's been a big percentage of when you all came from a very...
Thank you very much,
Yes.
Mr. President. Cordelia, in light of the rise in cases, discussed when they might...
The task force is looking at it virtually, so we'll be...
I want to first virus. Dr. Fauci, you say
The doctors. I haven't seen the picture. Somebody said there's a picture with somebody...
selfish by not getting tested.
But because I think I will do it anyway.
Will you let us know
Fairly
the
soon.
results?
We're working on that. We're working out a schedule.
My second question, Mr.
You
President,
go ahead,
that was
please.
a follow-up.
Go ahead. Yeah.
I know there's been a lot of patients tested who need a test. So as of today, if not when,
Well,
when
that's
will
been
Dr.
true for a
Phil-
while, but I'll let Mike, why don't you answer that, Mike, please?
Well, as the President said, and Dr. Fauci has articulated, the nature of our current system where the CDC has samples sent and tests are performed, or state labs perform tests, or in some cases university and hospital labs perform tests, is generally adequate for all of this. The President tasked us with bringing together this extraordinary public and private partnership. Today, by some estimates, labs to authorize labs between 15 and 20,000 tests a day are able to be performed. But very soon, website, if they're symptomatic, if the questionnaire indicates it, be able to have a test there, and these incredible companies will process the test and they'll receive that information. But for now, the best advice that we can give for people is to speak to their doctor, as the President's lab can contact the state lab. Again, every state lab in the country can perform tests today. But what the President charged us with when I was tasked to take over the White House Coronavirus Task Force was open up tests all across the country. The President said a few days ago that we made it clear that any American that wanted to get a test would be able clinically to get a test, because I order a test. And fortunately, the President directed CDC to clarify that. Now, anyone in consultation with their physician, regardless in their state, but very soon, America in a test. Dr.
Once more time about the testing. What they do is they deliver both the specimen collection piece, because remember, it's a nasal swab. It's not a tube of blood. So they've delivered that to doctors' offices and hospitals, and then they will arrange to pick that up. The important piece in this all is they've gone from a machine that may have a lower throughput to the potential to have automated extraction. I know you don't want all these details, but it's really key for the laboratory people. It's an automated extraction of the RNA that then runs in an automated way on the machine with no one touching it, and the result comes out of the other end. So sample to machine to results. That cuts out a lot of the manual pieces that were happening that were delaying the test results.
And so with that, what's the timeline like from when you're tested to when you get results? Like next week, what should people expect?
Well, with the prior testing, it was taking several days because the test is slower. We believe with this test, because of its throughput, that the testing can be from start, remember it has to transport, to the laboratory that will run it. And then we're hoping that all can be finished within 24 hours, which is very similar to other tests that you received today. These are not point-of-care tests. We are working on point-of-care tests, but we have to realize point-of-care tests take 6 months or more to develop. So we're not waiting for those. We're still diagnosing this on nucleic acid. So it's an antibody. This is actually the antigen, the actual virus in your nose that we're amplifying.
I think you have to remember, though, we're working very closely with states, and so you have a smaller form and more targeted form of government going in and doing it, like in New York, where the relationship is very good, like Gavin Newsom, where he made some very complimentary, that's California, he made some really complimentary comments the other day about how we're working together. We worked on the ship together, but we worked on a lot of other things together having to do with this. And we're really, the relationship that we have, I can't think of a bad relationship. We're helping them. We're funding them in some cases, depending on what it is you're talking about. And we're all working together very closely. So we've done really, I think, a tremendous job of teamwork with the different states. All right, one or two more. And if you have questions for these folks, does anybody have a question for the folks up here? Who has a question up here? You have? Okay, go ahead. If you have a question, go ahead.
Thank you. I have one for you as well.
I thought. I know
no,
you
but I do
asked.
have one for them because I haven't heard this
I was waiting
yet.
for that. Go ahead.
Because I haven't heard this yet.
Ask them first, please.
Yes, I will. Okay, with regards to the CEOs, can you please tell us when you expect to see items like hand sanitizer that have been going out of stock very quickly back on the shelves? There have been a lot of reports about that. And for you, Mr. President, could you talk about a potential bailout for the cruise industry? You had suggested that could happen. Is that something you're still looking at, and how much would that be?
Well, I didn't suggest that it could happen, but I can tell you it's an industry that was very badly impacted by what's going on with the virus. And it's a great industry. It's a very important industry, and we will be helping them, and we will be helping the airline industry if we have to, assuming we have to. So far, people haven't been asking, but if they should be asking, we want to make sure our airline is very strong. And then one day, all of a sudden, wasn't looking so good. Interestingly, I was talking to Doug, and the numbers they're doing from the retailing standpoint, I guess because of this, your business is like the opposite. All of you you've been selling a lot of stuff. Do you want to answer the question as to the hand sanitizers?
Sure. Yeah, specifically, the areas where we're seeing pressure in the supply chain are surface cleaners, cleaning supplies, paper goods in particular. Hand sanitizer is going to be very difficult to have 100% in stock on for some time. We're still replenishing it and shipping it, but as soon as it hits the stores, it's going. The same thing's true for the categories I just mentioned. So all the retailers will be working hand in hand with the suppliers to bring that to the market as fast as we can.
What is your advice, though, for Americans who are seeking those items? What is your advice? They're selling out online, they're selling out in the stores.
I think this team has given you other examples of what people can do to fight back against this virus, and you should look at the entire list.
Dr. Fauci,
Please.
speak to that, it'd be good.
I mean, obviously, it sounds very simplistic, but wash your hands as often as you possibly can. And I know you're not always in a position to be able to wash your hands, but wash them as much as you can. If you don't have the alcohol wipes, try and get them. If you can't get them, just try as best as possible to do it. I mean, you got to do the best you can.
Well, just general preparedness. You know, you want to wash your hands. You want to keep distance from people. And if you're around someone sick, keep away from them. This is basic public health. Now, these guys are selling a lot of toilet paper. I don't know. Tony, do you need to give some guidance that toilet paper is not an effective protection against getting the coronavirus? They're selling out. But soap and water, hot water, soap, 20 seconds. That's how you do it.
Okay, one more. Go ahead. Go ahead. No, over here, behind you. Behind you.
Thank you very much, Mr. President. You have a great team, of course.
That's true.
My question is, Mr. President, are you happy from the Chinese response? What correctly really told you what really happened those days? And second, Prime Minister Modi or India have closed borders until April 15th, if you have spoken with the Prime Minister of India and if they have needed any help. And finally, sir, any message for the small businesses because they are losing some businesses because of this? Thank you, sir.
Well, on small businesses, the Small Business Administration is now stacked with money to help them, and we're going to make the money readily available if they need it, small businesses. We had a great time in India. It was an incredible 2 days, and he's a great friend of mine, and he's a friend of his people because he was greeted incredibly warmly, as was I, in that stadium. It was an incredible event, and I loved being with him, so just say hello to him. But we talked about everything. We talked about far more than just borders. And as far as President Xi, likewise, he's a friend of mine. I believe that we are dealing in good faith, that we just worked, as you know, and as I just said, we just worked an incredible deal, big deal, one of the biggest deals ever made of any kind, big even by the standards of some of the people here, the deal with China. But I think that they want to get to the bottom of things also. We're working, our drug companies, our pharmaceutical companies are working very closely with China and with India, as you know, and with all over the world. And they're all over the world. These are magnificent companies that are very, very knowledgeable. And we're very lucky to have them because I think you're going to come up with, whether it's therapeutic or whether it's just help in getting better, and then ultimately a vaccine, which takes a little bit longer because of the test periods and a couple of other reasons. You're going to have it very quickly because of the great knowledge, and they'll have it very quickly. They've made a tremendous amount of progress. Thank you all very much. We appreciate it. Thank you. Thank you very much.
Schools will close from 12:01 a.m. Tuesday, March 17th through 12 p.m. Friday, April 24th. The timing will coincide with spring break for most Washington state school districts. Under this order, schools must close and end classes by the end of this next Monday. The first possible weekday back would be April 27th. Just as with King, Snohomish, and Pierce counties, there are critical services that our schools provide that will need
to think through together. We may need some help from the private sector here too, because it can't all just be, city money. But these are civic assets, and to the degree that everyone can pitch in, including the private sector, to help mitigate some of the losses that are going to occur in this very, very important sector. We're trying to build a creative economy here. I'm about to give my State of the City address whenever I do give it, given the circumstances here on the creative economy, and we don't want to lose our assets before we start talking about gaining more assets. And obviously, this is all a circumstance, but I want to make sure we pay attention to that. And it shouldn't all be on the city's dime here. We need help from the other sectors of the community as well. Okay, thank you. Thank you very much. Hector Barone, come talk to us about parking holiday and what this has achieved in terms of helping small businesses during the traditional holiday periods and how we seek to extend that during this time.
Mayor and Council, Hector Barone, Assistant City Manager. So the proposal would be to allow free parking on weekdays after 4:30 and all day on Saturday and Sunday. Now, this is very supportive of our local businesses and small businesses throughout our downtown. We can implement this today if the council directs that staff. I did want to highlight to the council that there will be a little lag in terms of what the meter says. We're programming those meters so that they can display that it's free parking at those times. But what we won't be doing is we won't be enforcing at the meter during these specific times. We will be enforcing all other parking code violations. So this should be pretty straightforward, Mayor. It's all on-street meters providing free parking during the time that the council does.
Question is, I'm going to turn it over to Councilman Hanson to talk about this, and I have a question if he hasn't raised it. So go ahead.
You want to go first, Mayor?
I'm just the question's been raised about the Golden One Center and our obligation under the parking fund to pay off some of the debt. I understand that. I just wanted to get it on the record. This does not affect our repayment on our Golden One Center obligation.
It does not. In fact, when we looked at what the potential dollar value is, it's less than 1% of our overall parking revenue. I did want to inform the council that we are seeing parking revenue trends that are a little lower than expected, about 9% plus or minus for the last 30 days. Unpredictable what's going to happen over the next few days. In the overall scheme of things, this is a small percentage of our overall parking revenue.
Okay, thank you, Councilman Hanson.
Thank you, Mayor, and thank you for embracing this recommendation along with Mr. Chan and our parking team. Matt Ironman and his folks are awesome, so thank you, Hector. Again, a lot of this is informed by what we saw during the Great Recession, where streets were empty, restaurants were empty, and it had a huge pervasive negative impact on businesses, workers, and we want to get ahead of that. So one of the big messages is, much like we do at the holidays, this parking holiday says to folks, come downtown, shop, dine, keep your social distance, but enjoy. And it's not lost on most of us that it's St. Patrick's Day weekend coming up. While the parade has been canceled, there are many wonderful restaurants that have prepared to do specials, meals, all of that. I think that this will go in tandem with the program being worked out by Visit Sacramento, by the Hotel Association, some of our business organizations like the Downtown Partnership, to create a restaurant month, much like Dine Downtown, where prefix menus will be available. People can come enjoy a wonderful 3-course meal or other specials trips. We want people to staycation in the central city. We want them to dine, to enjoy. And you can follow all of the public health recommendations and still continue to engage economically, socially, to the extent that it's appropriate, but to enjoy our wonderful restaurants, our wonderful hotels. And while the Golden One Center is not going to be open for large events, there's a lot of good things to do still in our city. And we need to encourage that, especially during this period of time, people not stop going to particular Chinese and Asian restaurants, because there's been a big misconception that those places aren't safe. They are safe. And we are also working with, and I think we'll be able to announce later today, if not next Monday, a special set of promotions with Postmates, DoorDash, and Instacart to partner. Postmates is going to waive all fees and commissions on new restaurants that want to join their platform so that people can order from home. They'll be running other specials. Instacart is working right now with the Sacramento Food Bank and the River City Food Bank, making donations of food available, helping to organize volunteers, and we'll have more details on those things soon. But we need to, and I think the mayor just said this very well, we need to not just quarantine ourselves if we're not sick. We need to be sure that we're out doing things to support the economy, to support each other, and that may include also volunteering. And so if you need to come downtown, I think it's wonderful to know that you will not get a parking ticket, you will not have to feed the meter. Now, there may be people who come down and just park all day on a Saturday or Sunday. I hope they're spending money. That's really the key. We need to make sure we don't enter into a free fall where everybody runs away, because our central city, our city's economy is really dependent on people coming and enjoying. And I think this is one of the biggest things that we can do to send the message that you can have a great time and not have to feed the people. So, Hector, thank you for all your help and for the work that your team has done to make this happen so quickly.
Thank you. Thank you very much, Hector. Absolutely. Let me move on to the next one. Rather than discuss in detail how the school food programs will continue, I know Councilmember Ashby is working very hard with her district, with the Natomas district, and they're already working it, which is great, to their credit and your credit. I want to just make a general statement about schools. All the areas that I'm most concerned about in terms of how we come together as a community, it is around the potential and inevitable closure of the schools. And of course, there are a myriad of issues. How we make sure that kids are safe, how we make sure that kids, school districts make sure kids continue to get their education, and where will they be, depending on their ages. For little kids, we don't want to put little kids into large daycare settings. That defeats the purpose of, in a way, of shutting the schools in the first place. For older kids, how do we make sure that they have additional enrichment activities to complement or to help make up for what they're not getting at school? And then for working parents, especially healthcare workers, how do we work with the employer community to ensure that they support their workers, and at the same time we're addressing the needs of their kids, not just healthcare workers, parents who are working in any endeavor. Certainly working from home is an option, but there are many unanswered questions. And so over the next couple of days, we're going to be meeting with the school superintendents and our nonprofit communities to begin asking and answering some of the myriad of questions that are out there. And we may be coming back to the City Council for more action around how we can address the obvious and inevitable impact of closing our schools. Let's move on to the next one. This is implementing by March 20th all legal options available to the city to prohibit the eviction of renters that are economically impacted by the COVID-19 pandemic. This is an effort to address the plight of working people who fall behind on their rent because their some way that doesn't allow them to make their full paycheck. Susanna, I'm going to turn it over to you, Susanna Wood, to explain in a little bit more detail how we intend to go about this.
Yes, Mayor and Council, we're looking at, and we've done research into the city's ability, the council's ability to exercise its police power, and in that vein, be able to pass a moratorium that would address some of these direction from the council. We would present a urgency ordinance to the council in the form of a moratorium that you would adopt and would go into effect immediately. We are completing our research and our preparation of that ordinance as we speak, and expect to have it for the council consideration very, very soon. Whenever you have another meeting scheduled.
Okay, so what you're telling us is to actually implement this, we're going to have to come back into session, which maybe we will do next week, Tuesday, which we don't have a regularly scheduled meeting, but we can set one. In fact, let's do that so that this protection is in place. All right? Very good. Any questions on this, Vice Mayor?
Yeah, Mayor, thank you. I know the Sacramento